everyone. Can you hear me okay? I'm just kidding. I'm not there, but happy midwifery week. My name is Nicole Sekulich and I'm a certified nurse midwife that began my career at Trinity and started working at Trinity Ann Arbor. 3 years ago, I began a new adventure as the site clinical director of the 3 midwife service provides care at Trinity Livonia. I'm not there with you all as I'm on my way now to Palm Springs, California for the 70th American College of Nurse Midwives annual conference, where I will refill my midwife cup, connect with peers, expand skills through evidence-based education, and explore innovations that are shaping the future of midwifery. I'm going to share with you about my personal use of a TENS unit as a certified nurse midwife. Okay, that was too windy and too hot outside. The TENS unit that I have and that I use is the HiDow Acu XPD. I actually purchased this at the last midwifery conference that I went to in Albuquerque, New Mexico. It's the same unit that I purchased and I have used it on multiple patients. In the box is the actual TENS unit here, and you can see, well, maybe you can't see, but there are 9 different modes. When I am using it for a patient in labor, I will very quickly go over and kind of guide them on how to get it set up. First, these wires connect in here. At the end of the wires is the snapping points, just like how you would do like EKG leads. Each patient gets a fresh set of sticky pads. I connect them to the sticky pad prior to putting them on the patient just because that makes it easier and then you're not like pushing and putting pressure on the patient. One thing I will say is you do not want to touch this when the unit is on. You will get a zing. It won't hurt you. I mean, it will physically hurt, but it won't do any like damage to you, but it is a good zing. So it's a good note too, if you're going to take one of these off a patient, you're taking the pads off, just making sure that the device is turned off and the button is at the bottom there. 2 points that you put the sticky pads on, like that. I do have a video that one of the nurses was able to model for me yesterday. It's probably the most common way that I use the TENS unit. Anytime a mom has either unilateral or bilateral back pain or hip pain and they just can't relax, they're like unable to let their pelvis relax because of that pain. I think we've all seen patients that are like, oh my gosh, my back is killing me. You know, every contraction I just can't tolerate. They are the patients who I feel like say that the TENS unit works the best for. I usually tell patients to keep these clear plastic pieces as well, because they can reuse the TENS unit postpartum if they have severe cramping. You know, we've all taken care of multips who have that uterus that just is so intense that sometimes they're getting narcotics. I will try this. I will offer this before I offer narcotics for uterine cramping postpartum. I don't think I've had a patient ask me for a narcotic after trying this. One other way to use this is if a patient's had a C-section, maybe they're allergic to ibuprofen, maybe they're allergic to Tylenol. This can go bilaterally above the incision or below the incision. You never want to put it on the incision. It's just not recommended for any TENS units to go over injured tissue. And same thing, they can turn it up and reuse it as frequently as they like. The unit does recharge by USB and it charges really quickly. So sometimes I will throw it on the charger if it hasn't been charged, and within 5 minutes it'll be fully charged. I know that sounds a little absurd, but I have seen that happen. Probably one of the biggest challenges that I run into with this being my own unit, and I feel like I'm protective of it. If we do have a patient that uses it, I will usually hand off that, hey, the TENS unit is in that patient's room. If for some reason we do not go and get the TENS unit out after, I did put this very formal taped on paper that says, please return to the CNM office with a big smiley face. I've talked with the nurses that if they ever see these cords into the garbage to keep them, because I don't know how they would get replaced. I'm sure they could be replaced, but I've not had that issue. And then it just sits in our office and it's charged into the computer and the USB port. So that's that. And then I had my video with Adriana, my supermodel from the hospital. She's one of the labor and delivery nurses. And she allowed me to put the TENS unit on her. She actually had me turn it up pretty high. She did not think it felt bad. And then we also put it on the front just to demonstrate kind of where it might go on somebody who's had a C-section. So that's it. Here we are at the birth center. I also have a comb that I like to use for acupressure. I'm gonna give it to Adriana. She can press it right into her hand there at that pressure point when she's having contractions. She's gonna lean over the peanut there. We're gonna get the pads ready. You do wanna go onto a clean, dry area. And then you can cover the pads with plain tape if for some reason they're not sticking. I'm just plugging this in here, getting this set up. You can use the TENS unit as long as you want. This goes through 20-minute cycles and can be restarted by the patient as frequently and as often as they want. You can see I'm putting the pads on there bilaterally. They can go horizontally, they can go bilaterally, they can be on one side or the other. Here's those clear pieces for you to keep and hold on to so that the patient can use them later. And then the unit can get turned up to a higher frequency, and then once it gets to a point that they don't like, it can be then turned down 1 point from that, and that's usually a good spot. Here's just showing putting the pads on the uterus postpartum for cramping or above or below the C-section site for pain. Again, this can be used as long as somebody wants. Thank you for watching my video on the TENS unit. I hope it was informative and fun. Happy Midwifery Week again, and if anyone needs any information about midwives, check out midwife.org. Have a great day.